Good evening. Welcome back. We continue with conversations around the status of healthcare in the country. Remember, this is The Impact, a special coverage on the situation that we find ourselves as patients or waiting candidates to be patients in these hospitals. In studio with me, we have Gen Z Badi, also known as Charity, who's here to talk to us about the same. Karibu sana. We also have Beatrice Kairu, who is a health economist. Karibu sana. We equally have Roslyn Alionya, who's the chairperson, Young Captains Gen Z Movement. Karibu sana. As well as Felix Sombua, who's national coordinator, Free Kenya. We're here to have a discussion as individuals who interact with healthcare facilities. We're here to talk about Kenyans and whether we are being heard. We're here to have a conversation as the young people who many would say that will spend most of their time on the face of the earth and would therefore want a health system that is working for them. But here, let's take this story. Gloria Milimu brings us some of the challenges facing our referral hospitals. Most of these hospitals, instead of offering research, now receive patients without referrals. Take a look.
These scenes have become the daily reality in most Kenyan health facilities, especially tertiary hospitals that are designed to provide specialized, comprehensive, and research-oriented care to referred patients. Yet, despite their specialized mandate, these hospitals have become the first point of contact for majority of patients seeking medical attention. After all, a hospital is where the sick seek healing and treatment regardless of its location, one would argue. But beneath these seemingly harmless choices and what experts would ordinarily refer to as inappropriate utilization of these higher-level facilities lies a challenge that transcends the very purpose they are meant to fulfill. Kenya still grapples with an influx of patients at both the county and national referral hospitals for medical conditions experts warn can be effectively managed at the lower peripheral health facilities. But as more patients bypass the lower levels of care and make their own way to specialized hospitals, the strain on the healthcare system stretches, leading to overcrowding, treatment delays, rising costs, and in some cases, life-threatening consequences.
So when the referral fails, patients lose time, they pay more out of pocket, they arrive late at higher level hospitals, county and national referral hospitals become congested with cases that should have been managed at lower levels. This weakens emergency care, maternal care, surgical care, and chronic disease care.
Ordinarily, a referral system is meant to function like a carefully coordinated chain of care, guiding patients from the community level to the dispensary level, and thereafter to the health center level, before the case is escalated to the sub-county hospital level. Only then can conditions that cannot be managed at this level be referred to the county referral hospital and then escalated to the national referral hospital if proven clinically necessary.
Many patients bypass primary care, primarily because they do not trust the lower facilities, because those facilities are often not equipped to solve their problems. The fourth is the referral data is weak. We do not adequately track who was referred, why they were referred, whether they arrived, what happened to them, and whether the referral was appropriate.
While a well-functioning referral system is critical in ensuring patient access to care at the right level and that the referral system is seamless in the event specialized services are required, this is not often the case, as Kenya lacks a properly functioning referral system, according to experts.
Many lower health facilities are under-resourced, they lack adequate staff, they lack commodities, they lack diagnostics, they lack theater capacity, they lack blood, ambulances are lacking, and emergency readiness.
According to the Ministry of Health, Despite the unprecedented increase in resources channeled to lower-level county facilities through the Facility Improvement Financing FIF Act and the Social Health Authority SHA, congestion at national referral hospitals like Kenyatta and county referral hospitals like Mbagathi remain a challenge, exposing persistent gaps in the country's healthcare referral system. For instance, Mbagathi Hospital, which is a level 5 county referral hospital with a bed capacity of 485, received at least 30 neonatal intensive care unit patients from 3 counties in 2025. Despite straining under the weight of referrals pouring from across the sprawling Nairobi County, the facility received at least 108 maternity referrals from the neighboring counties of Kajiado, Kiambu, and Machakos during the same period, a reflection of the growing dependence of an already overstretched urban referral facility. The hospital's chief executive officer told KTN that the highest number of these referrals were from the neighboring Kajiado County.
For inpatient, still Kajiado referred the highest number to Mbagathi. For the year, in the year 2025, they referred 162 patients for inpatient. Kiambu referred 101. Then we received 9 from Machakos, 4 from Murang'a, and others.
We tracked down one of the patients who had been referred from Kajiado County, and his health journey highlights the need for counties to invest in quality health care in order to facilitate access to timely health services within the counties people like JC Mubaya reside in. Mubaya was confronted with lack of a definitive diagnosis, and despite multiple visits to hospitals in Kajiado County, he was met with uncertainty and inconclusive assessments. And it was only after a referral to Mbagathi Hospital that the severity of his condition came to light. He was diagnosed with a blood clot in the head, and an urgent surgery to remove the clot was performed.
Kwa maoni yangu ningeona tu ni vizuri kama unajua sasa kama hospitali za huku zingekuwa zinaweza kufanyia watu matibabu ya aina hiyo, hakuna vile ningetoka hapa niende huko Mbagathi. Lakini kulingana na vile hospitali za huko ziko sasa, ndio sababu watu kufanya nini, ndio sababu tulionea ni vizuri kwenda Nairobi.
Much as the national government has now adequately addressed the issue of finance, healthcare financing through SHA, then let's look at other components and see when this money is sent to these rural facilities, how is this money being spent?
The idea of FIF is good. The implementation of it has been uneven. FIF was meant to allow public facilities to retain and use revenue to improve services, to buy urgent supplies, support daily operations, strengthen primary care, and improve quality.
In what now seems to be a move to permanently resolve these bottlenecks, the Ministry of Health is now banking on the Kenya Healthcare Referral Policy that is still undergoing stakeholder consultations before it is adopted. Once adopted, the policy is expected to strengthen patient-centered care by creating seamless pathways across the country's health system. It is also expected to facilitate faster and more coordinated referrals and at the same time reinforcing Healthcare Delivery Act at the county level. Gloria Milimu, KTN.
Thank you, Gloria, for that report. And that story right there, one asks the question, at the time when we were moving from NHIF to SHIF, one asked the question, what was the plan? Did we take this system through a pilot program that would also address matters to do with the referral system? Because based off the structure of it, level 2, level 3, would then have individuals, patients referred to level 5 and level 6. That, to me, is common sense. But one asks the question then, Felix, the system that we're using today, and we look at healthcare, not just as SHA or SHIF, we're just looking at the entire healthcare program, has it been thought out well, such that it will meet the requirements of the Constitution. And when you talk about the requirements of the Constitution, you just read Article 43(1). What does it guarantee? Every person has the right to the highest attainable standard of health, including accessible, affordable, and quality healthcare services, reproductive health, and emergency treatment. Where we find ourselves as Kenyans, are we achieving that? Are we getting that as Kenyans?
To start with, I would say that healthcare should not be treated as a privilege. It's something that it's a service that should be offered to all Kenyans. It's a right entitled to them through the Constitution in Article 43. It does not need one to make so many speeches to explain how it's working. We just need to go to hospitals and see how Kenyans can access healthcare services with ease, without any corruption, without delay, without failure of systems. Is that working? It's about policies. It's about tangible results. We do not need to politic on this. We do not need to side to protect anyone. We need to speak the reality as it is on ground, because we are suffering. A young man in Turkana, a lady in Tana River, a man in Mombasa cannot get what they want on the right time. Why? Because maybe SHA isn't working, maybe doctors are on strike, maybe there is no medicine in the hospital. A question comes up. Mm-hmm. Is the government really careful on health system? Because when everybody is sick, we were going to have a sick labor force.
Okay. Alionya?
Yes.
It seems as if when you talk about healthcare in the country, we've had everything that has been said. Many would say, and I would quote, there is too much politicking, less boots on ground, zero results to be seen. Is that the situation?
Thank you, first of all, for having me in your studios. This is the first time I'm actually on KTN. You know, you are feared to be one of the media houses that actually writes the most injecting articles. So I've come here to feel the injection. Mm-hmm. But that aside, we need to understand that health is a devolved function. And I've seen a presentation there where the presenter is talking about a certain hospital. Yes. I would love Kenyans to understand which hospital is under the county. Yes. And which hospital is under the national government. Mm-hmm. So that if you go to a certain hospital in Machakos and find there no medicine, who should you be blaming? Mm-hmm. It should not be the executive government, it should actually be your county government. And I feel like people have not yet mastered that art. And that is why when SHA was actually being put in place to replace NHIF, it was discussed both in Parliament, where people went and voted, and both in Senate. And by the way, I would love Kenyans to take note of these statistics of the voting pattern in Senate. Mm. In Senate, 33 senators voted yes for this bill. One of them, Boni Halwale. Another one, Nyutu. Another one, Meto. Right now, who's the loudest freedom fighter. Mm-hmm. They voted yes for SHA. Another interesting item, 35 senators were absent on the voting day. Just tell me, if 35 of them showed up, even if they were voting no, and they voted no, that means we will not be having SHA right now. We're probably talking about modification of NHIF. So, if anything, the people who are always loud, and the way you have mentioned it, politicking about SHA, are actually the people who brought us this problem. Boni Halwale is one of them, and he's a doctor. By the time he was voting for it, I believe there's, aside from the certain academic background, where he was forcing us and telling us, look, this one is the best. Go to the National Assembly. The person who was a member of the whole health committee at that time, one of them who is the greatest freedom fighter as of now, is Anthony Kibagendi. Is it Kitutu Masaba constituency? Yes. Now imagine, these are now the people who are criticizing a bill they voted for. I have so much beef towards the legislature at large. Because there are some parliaments and even governors who are always on the rooftop saying so must go, but they're forgetting it is your level 4 hospital that is not functioning. Yeah. It is your level 4 hospital that does not have medicine. So before we start asking the person at the top, what have you done with the county funds umepatiwa for that health system in your county? So unless Kenyans get to deliberate and differentiate these things, health is a very critical issue. And before I even continue, I just want to take a roll call here. Yes. I want my brother to tell me if he's a registered member on SHA. My
Felix,
brother.
Are you registered?
On SHA?
No.
Are you?
No.
Are you?
Yes, I am.
Are you? You are. How much are you contributing?
I stopped contributing because
How much are you contributing?
I wouldn't tell you the number.
You don't want us to know your salary.
We will calculate. We will calculate.
But clearly,
yeah.
My brother has been so loud to criticize it. So you know me, I'll ask him, have you ever
Are
used
you
SHA?
registered?
Personally, I'm registered. But the
Are
thing
you
is...
You know why I didn't register?
I'm just making my
We'll
I'm just making my presentation.
Yes.
I want Kenyans, and I would love to be on this panel with a Kenyan who has gone to hospital na SHA ijamhudumia.
Me.
The same
Me.
with a Kenyan who has gone to the hospital na SHA imemhudumia, because we have hospitals where you'll find 2 patients have gone there. One, it has been successful. Another, it has been an issue. So these are the concerns that people need to be raising, so that even if the minister would be watching right now, will know that in a certain hospital, there's this issue. That article that you have highlighted there, there's the issue of referring someone from the level 2, level 3 hospital to level 6. That is something that Kenyans have not understood. Today, mimi nikitoka kwa nyumba yangu nikienda kuchukua matibabu, the way he has just said it, I'm likely to go to Kenya National Hospital and not to the hospital closer to me. But Kenyans need to know the procedure. First, you need to go to that local that is close to you. And then when they see that they can't do, probably you require surgery, now they refer you to the hospital at the top level. So I hope we'll deliberate on the successes and the misses of health, but I was just mentioning on the politicizing, because the people who voted yes for this SHA, sisi hata tuko tunajua SHA ni nini, tulikuwa kuna sufuria kwa maandamano saa hiyo, are the loudest at the moment. And I ask myself, this problem that you created, I would rather you give us solutions to the problem, but not criticizing it the way they are doing.
Let me come to Beatrice. We've heard about politicking, and people have been called out, you know, name and shame.
Yes.
You voted for it. Why are you making noise about it right now? All you need to do is get it into the very same house and fix the damn problem that does exist. But from an economic angle of it, healthcare is never free, because even the Constitution itself speaks of an affordable healthcare. That means every Kenyan must contribute to getting that healthcare. But we also read and understand what the political class says. President William Ruto says, register, go to hospital, get treated, go back home. If anyone asks you for money, call me. From an economic aspect of healthcare in the country, are we looking at a broken system, governance systems of healthcare that is messed up from the top going down?
Thank you very much, and also thank you for inviting me here again. I'll start from a philosophical point of view, because one of the things we do in this country, we do not understand philosophy aspect. And that's why we have a broken system. And that's why things don't work. Or when we design them, they don't work as they should. So philosophy says that development is not structures or neither buildings, but rather development is people. So whenever you want to set up a system, you must ask yourself, how will the people use that system? So for example, a point in case, I will talk about SHA. So when the members of parliament and the legislature and the president himself, when they sat down to design SHA, they did not think about the people of Kenya. Point in case, I hear Anyona here blaming the governors. Were the governors given time to build dispensary healthcare centers first, so that you can have the hub and the spoke first before making the SHA Act? So if that time was not yet created, then it was meant to fail. So when they come up with a system and they have not put the structures in place first and then pass the bill, then NHIF, as economists were saying, let NHIF continue as it is, as you set up the structures. They did not listen, and they said, no, we will go as it is. And when you say we go as it is, when you tell a mother to go to primary level 2 or level 3, and there are no medicines, there are no doctors, there are no nurses, they will definitely go to level 4. Well, they've been told they should start from level 2 and level 3. And the other reason is when you have trust deficit, because the first questions Kenyans asked, we contributed to NHIF. Where did that money go? When we were transitioned, people had paid premiums before in NHIF. Where did that money go? We asked those questions. Nobody responded to us. We all transitioned to a new system, and you start paying afresh. So when those questions are asked by Kenyans and you cannot respond to them, there will be a trust deficit, and the system will not work, because people are the ones who make a system work. It is not government, it's not structures, it is the people. So if the people are saying SHA is not working, if the people are saying the system is not working, it is not working. So listen to the people. Remember, they did not they did not go to the people for them to participate and say where is NHIF hurting them, so that they give their solutions and we improve NHIF. So the government did not do that, meaning they do not value the people for their opinions. So therefore, I'm coming to that. So already by looking at that holistically, there is a governance problem, because Kenyan leaders have this notion that they should talk down to people instead of having conversation with the people. And because they think they should talk down, force down issues down the people, then we will always have a broken system. So we have a governance.
Yeah, let me come to Charity. Charity, or which one do you prefer?
Either.
They're
all mine.
Yeah, so Charity, we find ourselves at a point where NHIF needed 700 million to 800 million to be fixed.
Yeah.
And that's based off we're being told by the political class, right? But we spent 100 and something billion shillings to bring up SHA, because it was a superior system that would enable us access healthcare more easily, be able to walk in, walk out, you've been sorted. But the public participation aspect of it is where the crux of the matter are. Because one asks the question, the people who would consume these is mwananchi wa kawaida, right?
Yeah.
Is mwananchi pretty much just Kenyans. Hakuna mwananchi wa kawaida. Kenyans would be able to interact with this system. Therefore, their opinion would be critical in shaping how that system was going to look at. Failure to listen to Kenyans, how has that affected the overall implementation of the entire healthcare system?
Thank you so much for the opportunity. Again, wacha nianze na kusema SHA is not working, kwa sababu mimi I'm registered and it has never helped me. When it comes to the mwananchi, to the Kenyan, I always say you can't do an exam, mark it, release the results, and declare yourself number one. It doesn't work like that. We set the exam as the people, the government does the exam, and we as the people mark the exam. So the moment we come out and say, SHA is not working, and then the next day the president says, watu wa porojo na uongo, na ni sisi ndio tunafaa kutritiwa na hiyo SHA, it honestly doesn't sit right with me. I've had Alionya blame the governors, blame the senators, but again, samaki huanza kuozea kichwani. Who is the man at the top? You see, ametuelezea level 1, level 2, up to level 6. KNH ni level 6 hospital. It is under the national government. The other day we saw at patients hawana chakula. KNH, a whole national hospital. Patients don't have food. And we'll go ahead and blame the senators and the governors. We've seen in this same country, MPs telling us, mimi niko tutam kwa sababu nikiruka one time, sitapatiwa pesa ile barabara niliwa promise. We've seen it. We've seen it. Our members of people we elected, people we empowered, have to staki kutumia majina mbaya, but they have to be at the mercy of someone and sing praises to someone so that the people of Kenya can get development. Is this really the country we wanted as Kenyans? It honestly doesn't make sense to me. Again, I also feel like health is, SHA is just one aspect of health. Yes. This week we had Nurses International Week. And I wonder, did the nurses in Kenya celebrate that week? Was it surely a week for them to celebrate? Do we even have nurses to celebrate to begin with? Because nimeangalia statistics, and 8 out of 10 nurses in Kenya are looking for opportunities elsewhere. Kwa sababu in their own country, ni kama a prophet is not appreciated at home. We've seen them strike, bad contracts, late payments. When you have a healthcare, or rather, health personnel who are not satisfied, that means weak healthcare system for Kenyans. Kwa sababu you can't tell me, daktari hajalipwa, hajalishwa, lakini nataka naenda hapo nimwambie masikio isikii, hii nasikia, hii macho yoni na anisikize na anitibu. It does not work like that.
Hata kuona na hata kusikia.
Hata yeye mwenyewe haoni na hasikii. It doesn't work like that, to be honest. Nimesema protest over delayed salaries, poor contract, unemployment, bad working conditions. A weak healthcare force means weak healthcare for Kenyans. Yes.
Felix, we start with the first question. Why are you not registered? But while you answer that, we want to look at the SHA is just a single component of the entire healthcare system, right? So we have doctors, right? Do we have enough doctors to meet the number of Kenyans in hospitals, so that when you get there, you're able to get in, see a doctor, facilities you get out. Do we have enough nurses, as she is alluding to the same? Do we have enough beds for admission purposes? Because today you'll go to Kenya's premier facility, Kenyatta National Hospital, and you'd find individuals sharing beds, others are on the floor. You go to hospital today, you get there at 10, and you want to access services, but because of the queues and a system that is, for some weird reason, not working, you end up leaving at 5 p.m., yet you are there at 10 a.m. One asks the question, with all these problems, has the healthcare system in the country designed to fail?
I would start by saying that...
are you registered?
I'm not registered, because out there in the market, you'll find that there are better covers that you can get at cheaper rate compared to SHA.
Okay.
So let's not economize our health system.
Okay.
Let's not make it a profit-making entity. Let it be people-centered.
Okay.
When you talk of people-centered, it means thinking of the marginalized, thinking of the border man who earns 300 shillings a day, and at the end of the month you are asking for 800 shillings or 1,000 shillings. What percentage are you robbing from this poor, young, innocent Kenyan? When I talk of an healthcare system, it has to be as good as the government. If the government is corrupt, if the government is full of rhetorics, people will continue suffering. Look at how tendering is done in health system. Is there transparency? Why do we have inflation of items that are meant for the good of the people? Items that are meant to take care of our health. We talk of the beds in hospitals. Go to Mama Lucy. See how women are lying on the floor in their labor pains. Is that what SHA came to do? Look at the young kids in the primary school. Edu Afia was abolished. Those are the questions that arise that make us think that we are led by men and women who only think about themselves, their families, but are not patriotic enough to think of these young Kenyan born in the slums, how they will survive measles, how they will survive to an age where they can be dependent.
Yep. I want to come to Alionya. Alionya, you mentioned earlier in terms of your beef, pretty much, with the legislature in the country. And let's talk about them for a moment. Why? Because that is the body that discusses budgets, appropriations, oversight, and everything about it. So we have, as well, questions that, that Beatrice is asking. We had NHIF. I was paid up. You introduced SHA. Where did that money go? Who is supposed to oversight that? The National Assembly, because that is their work, And the president himself, while as well pushing for SHA to be there and to work, right? We need answers to those. But while at that, many would go back and forth and look at the entire legislature as a body that is supposed to protect Kenyans, because Kenyans have donated their power to them to represent them, take care of them, and protect them through legislation, through oversight, through representation. Would you reckon, rather, what is the position with regard to National Assembly being, legislature pretty much, being the weakest link in enabling Kenyans access quality healthcare?
I would agree with that statement very strongly, because if you look at the data I was giving you of the 35 senators that were actually absent when people were voting for this SHA, and this discussion had been taken to the Senate because there are some health functions that are completely devolved. So they were supposed to speak on behalf of their counties. They were supposed to highlight these challenges in this model on behalf of their counties. There's even one senator who abstained from voting. This is Senator Ososi. When the people of Vihiga were looking up to him, let me tell you, my brother, if today Ososi voted no, and today he criticized the model very loudly, the people of Vihiga would have said that is our person speaking. But it can't be. Time here are very critical. You know, for the finance bill, we didn't see this kind of nonsense that is someone missing, because of course, tungekusalimia. But why is it that for this SHA, that is actually the greatest debate in the opposition at the moment, is something they failed to show up to actually vote on it. So that's why I have a very great beef with the legislatures. And this is because of the role they have. Let me tell you, if today a bill went to Parliament or Senate, and all of them voted no, I mean, would the president pass it through their throat? He wouldn't. But if people stay away just because they have a contrary opinion to the people voting yes, it beats the logic. Because in politics, your vote, whether you vote for someone who loses or you vote for a bill that doesn't even pass, your vote counts. Today we would be sitting and saying, even Sifuna, you can imagine Sifuna was absent on that day, and I'm challenging people to go and check how people voted for SHA. It disheartens me, because the things they say on cars and rooftops are the discussions they should be having in the Senate. There is the challenge of, I think, the referrals that people have talked about. There's the challenge of medicine in hospitals. That is a challenge we should not even be smiling about, because the truth of the matter is, all of us seated here, personally, I've never gone to the hospital for any chronic disease or something. I might not even know what people are going through in SHA. I might not be even in a good position to speak about the successes of SHA, because I don't know what it is, what it takes to have cancer. But now the government has said we have increased the allocation of cancer treatment from 500 to 800. Now, when you want to ask these people, is SHA working? You should not even ask me as a Lyonya, because I don't know what, chemotherapy means.
I'm going to give you.
We should be asking these people. But that aside, I want to emphasize, because the question you are asking is a question I wish Kenyans, wale wako nyumbani, the problems of this country, 97% of them is because of the parliament we have. And I hope in the next parliament, ata kama sijui kama nitaitisha kiti, you should be having people who are debating, because you can see young people debating consciously about certain bills that people passed.
Yep.
Some years back. So until Kenyans realize the importance of the Senate, until Kenyans realize the importance of the parliament, we will still continue crying. But I am still waiting for a moment where you let me highlight the successes of this SHA.
All right, we will get there. We will get there. I want to look at, I'm going to give you examples that do exist. There was a time while I was doing my show at Spice, there's a gentleman who called us in the morning who is a chronic patient. And this gentleman had gone to hospital, was treated for cancer, but it came back. And when this man went back to hospital, he was told that despite being paid up, that the system would not recognize him, and was told to pay afresh. And after paying afresh, still he did not get the services. This gentleman I'm talking about is paid up fully twice, because his premium was ending in November. He's been paid to pay afresh, I think, in February. Now, this gentleman, because every time he goes to hospital and is asked for CT scan, is forced to lie of his condition and how he's feeling, so that he is not asked to pay on top of him being registered, because he does not want the dignity to be robbed from him. He is paid up, But this is what is being told in a hospital. I'm going to give you very many examples that are there. These are people who are saying this is not working. But that notwithstanding,
but even before you continue, we would love to know which hospital is that. Because at the moment, as a country, just 1 minute, we need to individualize problems. If there's a problem at KNH, like my sister has mentioned, the person or the person in charge of KNH should actually even be calling in to explain to us why is it that there is no
What I'm
food.
saying is, I don't object. I don't object, Alionya, with
Yes.
what you're saying. Just here.
You see those examples?
I'm not objecting what you're saying.
In just
Alionya.
1 minute, let me land my point in 30
Because I need
seconds
to
then.
interview others
In 30
as well.
seconds
All right.
then. Kenyans need to come out with these cases more often, but don't just highlight the concern. Mention the hospital, mention the owner of the hospital, and then let us do the work of investigation.
The owner of the hospital is the government of Kenya. And I'll not mention the hospital here.
But you need to mention, because that's the only way we'll clear up these issues.
Here's the case where this individual then, to him,
Yes.
SHA has not worked. And the Constitution of Kenya that speaks about offering healthcare services to the 55 million of us,
Yes.
if an individual has not gotten that, that qualifies to say the system is not working.
Very true.
All right?
Didn't work for him.
Because it said no one is being left behind.
Very true.
Has it been designed to fail? Because we talk about the means testing system that is there.
Yes.
That we look at you live in a house that has roof as everything else, and allows you to pay more than the wealthiest person who has several businesses, but you only look at one income.
Yeah.
Has it been designed to fail, and how can we fix it?
Yes, it has been designed to fail because the way the design of the healthcare finance, let me now call it healthcare because SHA is an aspect of healthcare financing, does not suit our economy. The way it has been designed, it suits economies that have majority of the citizens in formal employment. And the reality is, as Kenyans, 84% of Kenyans are in informal employment. So it's this informal employment whereby majority of Kenyans have low income. Remember, 2% of the population in this country control almost 90% of the resources of this country, leaving around 10% for the 98% to share. So that tells you already Kenyans are already strained economically. So when you come and tell me to pay premiums from my meager income so as to access healthcare, in essence, you're saying, I cannot afford that healthcare. Remember, when you increase money or when you increase payments to healthcare to a rich person, he can absorb it because he has enough income.
Yeah.
But when you introduce payments or you introduce income, or when you introduce payments to a poor person, they cannot absorb it. It means in economics we call it opportunity cost. They'll have to choose between unga or I pay my SHA premiums. And if I pay my SHA premiums, I will not have unga. That's where they have left the common mwananchi to be at. And therefore you realize that as much as they wanted the rich to pay for the poor, remember the rich will absorb it. But the poor, remember the middle class, remember these people depend on one income. They don't have several businesses. The rich have several businesses. I only have one business, and most likely that one business is my salary. So when you tell me you're going to take 2.75 of my salary, you've increased it where I used to pay 1,700 and maybe right now I'm paying around 8,000. So it means that 7,000 increment that I am contributing to a system when I seek services I do not get, it means that 7,000 maybe would have been used to buy for my mother unga at home because they depend on my income. But for the rich man, he has a business here, a business there, overseas there, saved accounts there. So when you increase 7,000 to them, they can easily absorb it. So how can we fix this system? First and foremost, we must understand the cycle of economics in this country. Remember, we are an agricultural kind of a country. We are not yet industrialized. Let's not lie to ourselves. That's why majority depend on agriculture. Today, if rain did not fall in this nation, actually, rainfall has really favored this government. If this government did not receive rainfall for 3 consecutive years, I'm telling for sure this government would have collapsed. but the gods they favored them. So if we are depending on an agrarian economy, for example, it means if the rains fail, that farmer will not have an income. And most likely, the shamba boy who makes an income from making those, from farming in that farm will also not make an income. So it means when SHA tells me to pay a whole year's premium, where will I get the money from? When you tell me that 60% of the youth of this nation do not have a job, and then you tell me when I do the proxy means testing tool and you give me to say, even if you tell me to pay 300 shillings and I don't have an income, where will I get the 3,600? So in essence, what we are saying, they should design a system whereby can the cost either use sin taxes, where you say collectively set aside funds as government, so long as I have an ID as a Kenyan citizen and I walk into a facilities, can you document record and then charge the government? Because either way, I pay fuel levies, either way, I will pay VAT taxes, either way, one way or another, there's somewhere I will pay taxes. I will pay taxes.
I mean, let's look at then on matters to do with doctors and health workers, right? And let's take this story. Recurring strikes by healthcare workers are once again laying bare the fragile state of Kenya's health system, as experts warn that chronic underfunding, weak governance and failure by the government to prioritize healthcare is pushing the sector to the brink of collapse. Even as clinical officers down their tools and nurses issue fresh strike notices, concerns are growing over survival and safety of patients who rely on the strained facilities for care. KTN's Aman Kamariki reports.
Kenya's public health system is once again under strain, with a growing wave of industrial strikes from clinicians to nurses and even doctors. The now too familiar cycle in the country's healthcare story is increasingly being blamed on systematic failures that remain unresolved for years. Clinical officers say their collective bargaining agreement CBA has stalled for more than 8 years, a delay unions describe as outright negligence by employers.
As someone has worked for 30 years, they are still at job group J after they were employed at H, meaning they have only gone one job group. It is really devastating. So unfortunately is that the employer always project and budget for promotion, and where the money goes is what we cannot even tell. So you feel that those staff are feeling unsupported and unmotivated to work. The extent, then that's why the union is there, that we have to act and push the employer to go on strike.
In Nairobi and other major towns in this country, public hospitals are sinking deeper into a crisis, with some facilities left operating on skeletal staff, as interns and medical students struggle to fill the gap whenever healthcare workers take to the streets. Patients caught in the middle are increasingly being forced to seek treatment in private hospitals, where costs remain out of reach for many. The Kenya Union of Clinical Officers now warns that counties are struggling to manage healthcare, with strikes still being reported in several regions.
We talk about referral services being a service that is supposed to be offered by the national government. So then you cannot demarcate or put line in terms of where the county ought to work and where they are not supposed to be. So then what we ought to see in a working situation is where then they are working synergetically to guarantee services. But when you want to say, these are my facility, you can't employ and second staff here, then it become a problem. But also the national government has a responsibility to capacity build the counties, which means that it actually give them a mandate where they can even employ staff, where counties have not enough staff, like the referral facilities, which is supposed to have like 60 clinical officers, they have only 20 clinical officers. The national government can say, I want to employ and second to you.
Stakeholders have also accused the Council of Governors of defying court orders and failing to honor return-to-work agreements, further worsening the stalemate. Healthcare economist Beatrice Kairu argues that the recurring strikes are merely the visible cracks in a much larger problem, noting the unrest is not the disease itself, but a symptom of deep-seated structural failures within the system. Poor working conditions, lack of essential equipment and chronic understaffing continue to define many public health facilities, compounding the crisis. Kenya's health sector has in recent years witnessed repeated strikes by doctors, nurses, clinical officers and laboratory technologists. In March 2024, doctors staged a 56 nationwide strike, while other cadres have downed tools for even longer periods.
We have done our own audit. There have been more than 103 strikes in the health sector since the devolution. And the issues that have been informing this strike is the same common issues that we are talking about. However, there have been even sometimes strikes during the COVID time when we were striking to be provided with the PPP, that is the personal protective equipment, PPE, which you'll be surprised to understand that some counties, if you walk today, those are still problems that we normally experience.
The Kenya Medical Practitioners, Pharmacists and Dentists Union has blamed the unrest on poor leadership and weak governance, proposing the formation of a health commission or a return of healthcare to the national government. Similar proposals have been echoed by clinical officers' leadership and the Kenya Union of Nurses, as the pressure mounts on both national and county governments to act.
They are the people who have been given mandate by the people, by the citizenry, who depend on our public sector for services. At any time when the services are not there, it is a demonstration of your inaction, you as the employer. To the extent that employees, like the clinical officer, must go on strike to demand services, it is irresponsible, and someone should be able to take responsibility. So as clinical officers, I will still urge them to be strong, to work together and ensure that we are holding the employer accountable.
Across the counties, disputes persist from Embu to Meru, with the fresh strike notices issued in Trans Nzoia, Isiolo and Homa Bay. Under the current administration, unresolved issues surrounding the 2017 Collective Bargaining Agreement CBA continue to trigger recurring industrial action, with little indication of a lasting solution. And as the standoff drags on, it is the ordinary Kenyans who continue to pay the price, with access to affordable and reliable healthcare slipping further out of reach. Haman Kamariki, KTN.
Thank you, Haman, for that report. Esther, in these hospitals Charity. In these hospitals so in these hospitals as we talk here, so the entire facility, we have patients, we have doctors, we have facilities, the brick and mortar, and then we have the system which is SHA that would then enable you to get in, your details is there. And that system was said that if you access facility in Nairobi and you happen to travel to Garissa, it's easy for me to get into the system and look at your records, right? But I want to look at the health workers concern. I don't know if there is any year where we have seen health workers not go on the streets demanding proper pay, or them going to the streets demanding that they have facilities that would enable them offer these services. Now, when we hear that healthcare system, healthcare in the country is delivering, but healthcare workers are saying we are unable to offer services. Tunaelewana kweli?
Hapana. But kabla nijibu hiyo, wacha nijibu alionya kidogo. I always say the problem we have with this government, the biggest problem is blame shifting. Because I honestly don't understand why are we blaming Kenyans for saying SHA is not working. Because that's what she has done. Kukwambia, name the hospital. Kenyans should know which hospital they should blame who and who. It's not our work to audit hospitals. It's the work of the Ministry of Health to make sure every hospital in Kenya is working. It is not my work as a Kenyan to know ati mimi hii kikosa dawa nikimbie kwa governor. Mimi nikikosa dawa ninajua it's the government that is not working. It's not our job to honestly audit. The failure we are talking about is systematic. We are talking supply chain, we are talking staffing, we are talking equipment. It's systematic. Again, let's circle back kwa manifesto ya rais. Rais mwenyewe alituambia you will be treated level 1 to level 3 hospitals free of charge. He told Kenyans that. So it was upon the national government to make sure that level 1 to level 3 hospitals are indeed free of charge. But you can't tell me, wewe ndo ulisimama kwa gari ukaniambia nikitibiwa level 1 to level 3 itakuwa free, na sasa si free, ni blame governor. Si governor aliniambia level 1 to level 3 itakuwa free. Ni kazi ya rais. It's the national government. I feel like it was rushed. Mimi naona igava iko na obsession ya new things. Mimi sijui vitu mpya zinawa intrigue kwa nini. Sijui, yani aliingia tu akaona NHIF haibambi anymore. We need SHA or SHIF. He rushed it so much. And he gave Kenyans a half-baked cake. You can't give it. This is help you are talking about. You can't base people's lives on AI. Ati ninakuuliza mabati yako ni red ama blue, wewe lipa pesa nyingi. Ati wewe kama floor yako ni tiles ama si tiles, lipa pesa. These are people's lives we are talking about. We've lost people. Courtesy of SHA, courtesy of Ruto's government. So you can't come here and switch the blame to Kenyans and be like, wewe kama Mkenya unafaa kujua kama ni senator ama ni nani yako vote ndio blame. I'm already dead before I even know who am I blaming. So no, don't shift the blame. Ruto has failed. SHA is not working. The government has failed. Back to your question on doctors and service delivery. Mtu mwenye kwa ground ndio anajua Kenya nakwambia. Again, I'm a teacher by profession. I don't want to talk about education today, but it's the same thing that's happening in education. CBC, SHA, one and the same thing. These are things that were zilienroliwa bila enough preparation. Inaleta confusion, inaleta changes. There's a documentary that Africa Uncensored did on SHA, and they were saying it's an error. But it's a systematic error.
Yeah.
You know,
by design.
Yeah, it's an error by design. Thank you so much, Beatrice. It's an error by design. Na walienda ground, wakauliza watu. Baka mama moja akasema, ati mimi sasa mahali nimefika, I just pray that mimi, mtoto wangu, na bwana wangu tusigonjeke. Ati Kenya tumefika hiyo point ya kusema, heri tusigonjeke kwa sababu utadedi. It's that bad. So, in short, Kenyans are the ones who should give the feedback. And when Kenyans say it's not working, it's not working. Hata mtufunze roles za senator, roles za MP. Kama SHA haiwaka.
Yeah.
Kama hakuna dawa. Don't shift the blame, please. Kuna mbego it's also a leadership skill, or it's also a leadership trait to accept mistakes. Kusema nimekosea, it's also leadership.
Let me inject a little bit about the healthcare workers, why we have serial strikes. First and foremost, and I will back Anyona a little bit because it all boils to the budgeting in Parliament. So I said, development is people, not structures. So when you decide to build a hospital, you don't first think about the brick and mortar. You first ask yourself how many doctors you're going to employ, you budget for them. How many nurses are you going to employ? You budget for them. Medicine, you budget. Once you have done that, now you can start the brick and mortar. But these governments, or our governments, what they do, they start with brick and mortar. Then they're like, oh, how many doctors do we need? Oh, how many nurses do we need? And do they budget for that? So because of lack of budgeting, even when these individuals or these healthcare workers go on strike, and there's a CBA, remember those things they sign as a CBA? Yeah. The CBA is signed by a government without having budgeted. So now it becomes a push and pull because every time they go ask for their salaries increment, they ask on what budget. So it becomes gaslighting of the healthcare workers and the government all the time. So we need to go back to the drawing board. Can we deliberately prioritize whatever we do with our budgets? Why are we putting more funds to State House building? Why are we putting more funds to the office of the Deputy President to be using a helicopter, 80 million all the time? Yet we have UHC healthcare workers who have never been paid to date. Why? Because every time they go and they're told, where is the budget? Where was it budgeted? All those questions, it becomes every day, day in, day out. So our point, the reason why there will be perennial healthcare workers is number one, nobody sits down to budget for these individuals. And the day we shall sit down and start focusing on development for development is people, then that's when we shall move forward as this country. Yeah. But so long as our leaders are obsessed by brick and mortar, we'll all have hospitals all around, schools all around, but no children, no teachers, no books, no equipment. And they will, just like you remember there was a time, because using CDF, remember there was a time MPs were obsessed with setting up dispensaries, and some dispensaries in Baringo and some northern countries, what we are having are goats, using those dispensaries. So that money would have been used maybe to pay school fees for children, would have been better off.
Felix, I want to ask about the voice of Kenyans in all this, right? Because healthcare has to work for the people. And many would say that the best report card for you is the person who's using the services, the person who's using the facility, because those are the ones who would tell you, leo nilienda, haikufanya. Leo nilienda, it worked for me. Nilienda again today, it did not work. It worked for my mother, it did not work for my father, because we get to hear all these instances in it. But when these services, this system was being introduced to Kenya, we talk about the entire healthcare. Where is the voice of Mwananchi for them to describe the kind of healthcare that they want to be part and parcel of? Because here we're talking about even the documentary that you've just cited. There's a specific segment there that I found is very troubling, where we're being told that there were errors that were seen, but the government of the day decided to continue with the system with the hope that if you go and there is an issue on how much you're paying, there is an appeal mechanism where you can go back and rectify that so that you are well captured by the system. That goes to speak about a system that never really thought about Mwananchi, who should be the ultimate beneficiary of the entire ecosystem. Would you reckon then that the voice of Mwananchi in this instance wasn't needed or was never seen to be important?
Thank you for the good question, because this is an issue that needs an honest conversation. Let's stop politicking and defending how the status of the healthcare system in Kenya because you are aligned to one side. The moment you are sick, that is when you are going to realize that things are not working. When we say that Senate, National Assembly participated in this, there was no proper involvement of the people, that is public participation. Remember, Senator Okia had petitioned this. There was no quantifiable public participation. And it is on record that our government today is rushing things. They want to do error and trial on lives of Kenyans.
Yeah.
It's so unfortunate that today a teacher is promised a better package through SHA only when they die. That's when they are going to be given 300,000 to prepare their burial. Does it mean that they become useful to the economy when they die? It's also a shaming when SHA is offering a better package for the elderly women in the teaching fraternity for maternity leave. But when you look at the majority of the young women in the they are being given a proportion that cannot even take care for them throughout the labor period, throughout the maternity period. We got to pull down our one-term, two-term attires and think of our health as a nation. We do not need to stick on who voted for what. Some were forced by their parties. That's why, like Sifuna, chose to abstain, because he could not stand to betray the people of Kenya.
Did he tell you that?
He's my friend, I know.
More of his
Mimi
friend than
Sifuna.
Yeah.
You can ask.
So, Aliona, I have not interrupted you in any way.
I'm just
Continue,
reminding you.
sir.
It is a pity when we, the young generation who have been so vocal, shouting, Ruto must go, because SHA was not working, today we are the hecklers of two-term. It is so perturbing that we forget that we have our mothers, our fathers, our grandmothers who have chronic diseases, diabetes, cancer. They need clinic now and then. We who are supposed to be standing in the gap to offer the financial solution, and we invested in that SHA. When you go to hospital, you're told to pay again. I have a case that has been on media, a gentleman complaining that his SHA account is being used elsewhere. Is that what Kenyans should rely on?
Yeah. Let me come to you, Alionya. We want to look at SHA, successes and failures of SHA, and look at solutions that would enable us as Kenyans say, we fixed SHA and it's working for us. What are some of the successes that you have?
Thank you. That is what I was actually waiting for. And this debate would have been more fruitful if we looked at the successes, challenges, and we gave our recommendations. But before I even get to that, my sister Jezi Badi uses a lot of energy to yell, to complain, to cry, to shout the loudest. If she used that energy to give us some of the recommendations and solutions to the problems we suffer in this country, tungekuwa tulifika hata Singapore before 2027. But even before that, I just want to share some statistics for her to know that it reaches a time you don't have to yell. You just have to sit back, observe, and learn one or two things. Now, there's the success story of SHA, I mean for generality. The government has talked about, I think, increment in the number of people registered in SHA. I don't even want to look at that number. I want to look at the leading counties of people registering in SHA, in as much as people are telling them not to register. The first one is Nairobi, with a population of 1.64 million, and out of those, 800,000 are women. That is Nairobi. The second one is Kiambu County, where they have been told don't register. It is the second one with 832,307 registered people on SHA. The third county where my sister comes from, and I'm sure they are watching, but it just sends a message to you that they don't listen to your noise, is Nakuru County, with a total registered members of 730,260. Just go and check how many women are of those and how many are of those, clearly showing that no amount of noise will make Kenyans not register on SHA. And I want to use an example of schools. A school like Alliance receives the greatest applications of people who want to go to that school, simply because it is the best school. Clearly, SHA has reached, I think as of today, we are speaking of 30 million Kenyans. I mean, if SHA was bad, 30 million Kenyans would not be registering on SHA.
Can I ask you a question?
You just give me my time. The greatest challenge I see with those numbers is the people contributing. And I want to challenge Kenyans today, especially those in the informal sector. Of course, I've had a discussion about people paying annual premiums rather than monthly. That would be a challenge for someone in the informal sector. So if we can take it back for people to pay monthly. And I would urge people in the informal sector, ukishalipia SHA na umeenda maternity umesaidika, don't stop paying for SHA. Your child might need it in future. Continue paying the premiums. There's a challenge of the testing system that you're talking about, of how it is actually grouping the people in the informal sector. That is a discussion we should be having. What are some of the parameters that the government should now look at, if not the iron sheet that my sister has talked about? What else can we look at to ensure that we are actually ensuring that someone is actually contributing based on how much they can actually raise? So that ukiambia mtu 200, isikwe bado hiyo 200, haezi raise na monthly. That is one success story. The other one that I think I saw you people airing as of yesterday is a circular which came from SHA, I think, saying that I think free maternity delivery was something. You people can even elaborate further. Probably none of us here can talk about the delivery and how SHA is catering for the people in the maternity, because mimi bado sijapata mimba, sijaona sister yangu akiwa na mtoto, sijaona. It is the people in these labor wards we should be asking, is it true that whatever they are saying it is happening in the labor wards. The greatest challenge I see with SHA is the aspect of medicines in hospitals. But me ukaa chini najiambia, there's a time I lived in Machakos, the level 5 hospital in Machakos, ulikuwa unaenda. I actually went there to remove my teeth. Na ile dawa ya kudungililiwa ndio utoe meno, I had to buy it myself. But then I asked myself, those dispensaries out there, zenye ziko pale nje, ni dispensaries za nani? Za madaktari wako pale kwa hospitali. When will we get to the bottom line of the issue as a country to say, if I get you or even if you get me Alionya, I work in a hospital in Machakos, but I'm hiding medicine as a doctor to sell it in my chemist outside. You will look me in the face, hata kama mimi ni rafiki yako uniambia Alionya, we cannot continue doing that because people need medicine. Right. If we never get to the bottom line of making people to be accountable. You know, people, I'm shocked. Someone is saying we can't blame MPs for the problems we suffer. Someone is saying we can't blame governors. The people watching are even wondering, because there's a reason why we elected a governor, there's a reason why we elected an MCA. And Kenyans, kindly register as a voter. And don't focus only on the presidency. That MCA hapo, that MP, that woman rep, that senator, don't be ignorant to think they don't affect. This SHA is affecting us because people voted for it. Others abstained from it when their opinion mattered most. And so I will leave by saying that it reaches a moment, especially for health, we have to put the politicking aside. And because none of us has used SHA, you cannot even have the audacity to tell us SHA is not working.
Let me come to Beatrice. Beatrice, we've heard about the successes and the challenges that do exist in SHA. But I want just to look at SHA because, like we've said, SHA is a single component of the entire healthcare system. It's a health right? So I want us to look at the issues that have been raised, right, and the problems that do exist. Number one, are they issues that the government, the leadership that is in charge of ensuring that Kenyans get this access do not know? And whilst that is the position where we find ourselves in, who takes the greatest responsibility, right? We will say members of parliament voted to pass SHA, sawa. Senators voted to pass SHA, sawa. But we also recognize that when we talk about matters to do with appropriations or budgeting of all these ministries, it originates from the ministry departments, then goes to cabinet, then further comes back to parliament. Can we disassociate these from the leadership in terms of governance of the same?
You cannot dissociate because the CS for health sits under who? The president himself. So you cannot dissociate. At the same time, who is going to collect these budgets? It's a CS for treasury, right? And then presents to the members of parliament based on each items that have, each department comes up with line items of what they need and all that. But can I shock you that there is money that is unspent that is allocated for healthcare? Like in the year 2022-2023, 17.5 billion was never spent, yet it was allocated for healthcare. In the year 2023-2024, 24.4 billion was never spent, yet it was allocated for healthcare. The year 2024-2025, 13.29 billion was never spent. So in those 3 years of this tenure of this government, 55.25 billion was unspent. So it means, but was allocated. Budgeted. So budgeted, allocated, but unspent. So that means there was a service delivery somewhere that was not received by a Kenyan. That already is a governance issue. Because you cannot tell me women are sharing beds and there are billions not being spent. You cannot tell me there are machines that are not working in KNH and there are billions not being spent. Okay? So you cannot tell me that there are medicines not on the shelves of hospitals, yet there are some billions not being spent. So clearly it means that either people don't know how to operate that budget, execute it, and ensure that service is delivered. So that already they have failed in terms of governance completely. And I would like to correct Anyona here and say...
My name is Aliona.
Aliona, sorry. I would like to correct her and say, if I register and not contribute, then it means it's an empty shell. What is the logic? You know, many times you don't use logic, but it's good to use logic and ask yourself, so I have registered 30 million Kenyans, but they're not, only 5 million are contributing. It means 25, why are 25 million Kenyans not contributing? It's simple maths. You know, maths is it's essence, it's day-to-day life. So if 25 million Kenyans are not contributing, you cannot call that as a success. The day we shall say SHA is a success is when the 30 million Kenyans are actually contributing. And what we saw with NHIF, it was gradual success of people increasing to contribute to the point it was gradual. But when they did a sudden transition, all the successes that we had already accumulated with NHIF all went up the air. Let
me come to Charity real quick. Charity, it's been said that Nakuru is among the counties that have registered a lot of Kenyans into SHA. That is based off reports that you do have, and you can't dispute it. But we also have to go further and ask, fine, these people are registered, are they paid up? And if they're not paid up, where is the failure? Did this communication get to them? Were they involved in this entire ecosystem of setting up this system? But then again, there is also the aspect of pending bills. Most of hospitals today are saying we are unable to offer these services because the government of Kenya has not paid us for services rendered. How big a problem is that in terms of Kenyans accessing healthcare?
It's a big problem because, again, I feel like our government has what we call misplaced priorities. They place their priorities wrongly. You know, I'll back Beatrice up because you can't tell me we are spending 17 billion State House na kuna hospitali hawajalipwa SHA. There was a time kulikuwa na a campaign online to push for SHA payment to be published. And we pushed for it, haikuwa published. I wonder why. You can't tell me bado kuna kesi ilikuwa imekuja ati one person is getting 4 open heart surgeries in a day and they have been paid for fully by SHA. One woman is giving birth 10 times in an year na imelipwa na SHA. Whereas we have people who have kidney failures, literally they need dialysis, but hapo ndio SHA inasema naomba nijitoe kidogo, yani naomba. It does not make sense. Misplaced priorities again. And I want to tell Alionya, I'm not switching the blame. I'm not saying that we can't blame Parliament, or rather we can't blame senators. I'm saying, has the national government also failed? Has the president also failed? Because again, the same way you are blaming the MP, you can't fully take the blame away from the president. He has also, ni manifesto yake. Again, I'll go back to the manifesto yake. Ilikuwa manifesto ya William Ruto president, not whoever the senator has who did vote. It doesn't make sense. And me being loud does not change the situation in public hospitals. It does not change the fact that Kenyans are dying because SHA is not paying for them. Again, if you register and don't pay, umetusaidia.
All right. Let's take this story. Residents of Baringo County are raising concern over the deteriorating state of health facilities, even as the Senate Standing Committee on Health tours the region to assess service delivery. The Senate Standing Committee on Health, led by Senators Jackson Mandago, Richard Onyonka, and Baringo Senator Vincent Chemitei, visited several health facilities in Baringo County, uncovering shocking conditions that have left residents exposed and vulnerable. As Ian Kitanyi reports, the findings paint a worrying picture of neglect and failing systems.
Kimalel Health Center in Marigat Ward, Baringo South, Baringo County. The situation is dire. Patients seeking care are welcomed by overgrown bushes, posing a serious risk of snake bites. Inside the facility, the conditions are not any better. Parts of the ceiling are falling apart, raising safety concerns for both patients and staff.
Tumejaribu kwenda kwa county government watusaidie, lakini they have delayed. They have delayed to assist us. Ulikuwa na theater mzuri sana, lakini baadaye some equipments were taken. Sijui ilipelekwa wapi.
Upande wa rooms imeisha kwa wards, na wards pia imeharibika sana. Hata ukiambiwa mtu mwenye ujui Kimalel lala kwa hii ward, nafikiri uweze lala.
The facilities theater, meant to handle emergency procedures, is non-functional. No theater bed, thus crippling critical services in the area. Health workers here say repeated appeals to the county government to address the challenges have gone unanswered, leaving them struggling to offer even basic services.
How I wish the governor and his executive and his members of the county assembly can come and look at this facility. This is so embarrassing. It is so depressing. Beautiful health center which has just been collapsed into zero. And you know these things collapse because of corruption, stealing public resources, just because some few people want to be rich. Then you leave the whole community naked.
The Senate Health Committee, which visited the facility, later presented its preliminary findings at the Baringo County Assembly, sharply criticizing the state of healthcare. The committee noted that the challenges at Kimalel reflect a broader crisis affecting multiple facilities across Baringo.
Baringo, we have a lot of challenges. We are doing badly in terms of health sector, especially the Damarabin, and also we pass through Kimalel. That facility was installed a long time ago, and the status of that hospital now is very, very bad. In fact, we are ashamed as a county, as leaders. We need to do something about that.
I mean, it is completely embarrassing that we can have such a facility. The community around there are crying that was the facility that was having a huge population. But of great concern is how the county government themselves vandalized the equipment that were in those facilities. The theater, the machines that were there.
Later, the team proceeded to Baringo County Referral Hospital, where similar concerns have been raised in recent months over service delivery and staffing. Ian Keitani, KTN Prime.
Thank you, Ian, for that report painting the picture and situation in our hospitals, especially at the counties. We've looked at the problems that do exist, wins and misses, but let's talk about solutions. Felix, let's start with you. What are some of the solutions that must be put in place for us to say that healthcare is working?
First, I would request that the government respects all the stakeholders in the healthcare system, because we have seen moments and times when the church, who is a key player and investor in healthcare, being disappointed by the delays of the disbursement of their remittances that are supposed to be catering for the bills. Again, let's just think of how we are going to have a new scheme that is going to work for all of us. And I don't believe that the government is ready to listen. So the best way to do, to kadi, wait for 2027 and come up with a new system to fagia wote kabisa.
What are some of the recommendations that you would give, right? Aside from throwing blame, some of the recommendations that you'd give to the government of Kenya, national government, county governments, for this system to work, and also speak to Kenyans, because you're registered, fine, you're not paying. Pay up so that you're able to contribute in that kitty to access healthcare.
Thank you. First, on the issue of, I think, contribution, I think Kenyans are complaining about paying the contribution, annual contribution upfront. So if the government can be lenient on the people in the informal sector, but this will require also the people in the informal sector to be genuine with themselves. Kama ni hiyo 200 and you can genuinely afford the 200, kindly just pay up, because it will actually come to just help you. And Kenyans need to look at this thing like this. If today, all of us here are supposed to use SHA, but he's the only one paying. That means he will be paying more and we'll be straining him more, rather than if we would have spread the risk on all of us, so that probably would pay all of us 100 for us to have money in that pool. So it is a recommendation to both the government and also to Kenyans. Lipia hii insurance. You know, there's some people who are telling you there's a better premium, but they are using Jubilee insurance. They're using very expensive insurance. They are earning in millions. They are not like me and you who are earning little thousands. Others are even earning hundreds in a day. So if you have been mapped up and ukambiwa pesa fulani, if you protest and you see you are not supposed to pay 300, you're supposed to pay 150, also raise these concerns for the government to know. The second thing, I think that something I have identified. Yeah. We have, I think, 6 referral hospitals in this country. So the government and I've seen the good intention of this government. Let us now have every county have a level 6 hospital. This is something that is doable. If today we can see Rironi Mau Summit being constructed to go to the side where roads were not even being constructed, we can see an SGR being extended to Malaba. That means we can have a level 6 hospital in Garissa that we are talking about. We can have a level 6 hospital in Bomet, so that these people don't have to travel all the way from their counties to come to the Kenya National or the KNH hospital. So if we can construct, I think, county level 6, this is a long-term thing. Probably other presidents will come and chip in, and even governors of goodwill and even investors. This is something we can do so that someone in Garissa, in Wajir, can get the equal treatment that we just get here in KNH. There's the concern of payment, where hospitals are saying, you know, I can't help you with SHA because I've not received payment. So this is something we can just push the government to ensure that those hospitals that are actually doing legal claims, not like the illegal hospitals that, like that one of Kibagendi that has 4 surgeries. His hospitals were among the ones flagged for asking more. Kama down in 2,000, yeah, anaandika 8,000. Such hospitals zikwe scrap na tuambiwe why they are being scrapped, so that people don't politicize them.
All right.
But lastly, Kenyans, register as a voter and ensure you vote for an MCA. Vote for an MP, vote for a woman rep. And if you see these young people here who are showing their interest, if you see them on the ballot and you think they fit your idea, vote for them to vote out the person who complains.
Let me come to Beatrice real quick. Recommendations to fix the healthcare in the country. Speak to the leadership.
First and foremost, when you see Kenyans taking loans to pay premiums, there's a problem. It means they cannot afford those premiums, and that tells you the system is not working for them. Number one recommendation I would tell the government, number one, abolish the AI proxy means testing tools. It is making Kenyans not access healthcare, stigmatizing some Kenyans, and also bringing a lot of conflicts amongst Kenyans. Why? Because some are told to pay more while they can't afford. Others are paying less, yet they can afford. That already brings conflict within a nation that is peace-loving. Number two, first ensure that the facilities are functional. I'll say development is people and it's not structures. So how do you want us to contribute to a system yet those facilities are so downtrodden that they cannot actually be fit being used by human beings? Then we need to have transparency of funds. Remember, a transaction always takes place when there is trust. So if I don't trust you, I will not transact with you. The reason why 25 million Kenyans are not contributing beyond the fact that they can't afford is because they do not trust the system. Why? We are finding ghost facilities actually being paid millions of Kenyan shillings, yet they did not offer any services. So there is no way I'm going to register for SHA, give you my contributions, yet there is no transparency on how those funds are actually being utilized. And I'm not being allowed to see how my contributions are actually being paid to those facilities. If the government can at least do that, then maybe I might consider registering for SHA.
Jane Z. Badi, what will it take for you to come back to SHA and become a participating Kenyan? What recommendations would you want the President of the Republic of Kenya to institute together with his Cabinet Secretary, Honorable Eden Duale?
I honestly feel like I don't want to waste my recommendations because I know the President won't do it. I know. Tulitokea kwa hizo streets tukasema reject, tukauliwa na bado.
But it's because you don't have any recommendation.
You know, Alionya, you are interrupting me because facts are uncomfortable.
Give us solutions. You can't so be crying on TV 24/7.
Let her finish. Let her finish.
You know, facts are uncomfortable, Dennis. Mtu akisema facts watu wanajam. But anyway, I think we've dug too deep a hole with SHA. We've lost too much money as a country with SHA. And I think Kenyans are asking the same question. What was wrong with NHIF? You know, it was serving Kenyans. Why did we have to scrap this thing off and bring a totally new thing that's not working? You know, Mswahili alisema, heri nusu ya shwari kuliko shwari kamili. Tulikuwa na nusu ya shwari na NHIF. Sai hatuna anything. It's not working for Kenyans. You know, and as I wind up, health is not a political slogan. Health is not politics. Health, it's pain for Kenyans. It is fear for tomorrow. It's fear of what if tomorrow I wake up and I am diagnosed, what will happen? It is mothers crying on corridors, you know. It is children dying, kwa NICU, kwa ICU, kwa HDU. It's not funny. It's not about defending which side. It's not about belittling which leader didn't vote or whoever. It's Kenya's lives People are dying because of health, you know, and Kenyans are not being heard. We are not being heard by this government. I wouldn't even, my brother has said we need a new system. I wouldn't trust this government to bring a new system. Kama wametupotezea 104 billion, 11 billion inapotea, 50 billion inapotea. Sijui ngapi billion zimelipo kwa ghost hospitals. What will happen if we decide to start and you see what trust waende tu home.
Excuse me, Dennis, I think you have been so lenient. You have been so lenient with girl child. You have given them more time. I wanted to add on something small. Before, when Kibaki left, we had Mama Lucy. She championed HIV campaign, and we saw her do something that really changed the health of our women. We had Margaret Kenyatta with Beyond Zero, with Linda Mama. Yeah. She really did good job. But now we have Rachel Ruto doing nothing.
Where kuna intercessor status?
So
all right.
we need also, I'm winding up, we need also to have government taking devolution serious.
All right.
Let monies for the counties go to the counties on time.
This is a good place to end the conversation this evening. Jenzi Badi, also known as Charity, asante sana for being here and for your contribution. Beatrice Cairo, asante sana for being here, a health economist as well, who's been here with us from 6 p.m. We also have Rosalyn Alionya, chairperson, Young Captains Gen Z Movement as well. Asante sana for your contribution.
Thank you.
And Felix Ongua, national coordinator, Free Kenya. You know, it is about health of the country. It is said that each and every single person is a candidate away from ending up in hospitals because healthcare is something you can't really plan for. But then again, it is said that you are a single sickness away from poverty. A Kenyan's being hard, the government of Kenya, what must it do for everybody to say that the healthcare of the country is working? This has been Impact. I'm Dennis Aseto. We have been looking at the status of healthcare in the country. A lot has been shared, a lot of recommendations given, and we only hope that moving forward, we will see the change that we all deserve. Asanteni sana. Good night. Until next time, good night.